others.
Yeah.
So if you're depressed or stressed, they can take that, they can culture those bacteria and then you eat it.
Yeah. And it helps.
Wow.
So it's probably going to be part of pharmacology now and medications, right?
Yeah.
Yeah.
Are they developing a drug for it? Does it say?
No, it doesn't say that. It just came out like a couple of weeks ago from actually University of Cork, which I thought was kind of funny.
Because I looked at that article too. I'm like, Cork, that's like the one, that's her sister's
Yeah,
school,
my
right?
sister's school. I was like, oh, that's really cool.
Is there any, I guess it doesn't talk about any like effects of it, like if you ingest too much of it, if anything happens, or side effects of it?
No, it's just like it's developing like how bacteria has also like communication between bacteria, your stomach, and the brain. Yeah.
So that's usually in the stomach?
Yeah.
Okay. Very cool.
Yeah.
That was really cool. But I wonder what would happen if you had too much of it. Do you think that could be a negative effect on your body?
I don't know. It didn't really go into it. It was just talking about how that they're learning that there is more connections with bacteria
in the body.
Yeah. And then going to the brain and helping the brain. So.
Would you think it would just be for like anxiety and depression like patients and psychiatric patients, or anything that anyone could just use?
I think it'd be mainly for people who have depression and stuff like that. I don't think it'd really affect us as much.
We'd probably make enough of it if you don't have it. Right?
Yeah, exactly.
It is recording. Okay. So I found an article about the role of chlamydia trachomatis in miscarriage. So that's the STI chlamydia. And so they did a study. They had 386 women, 125 with, and 261 without miscarriage. And so they took samples of, they did vaginal cervical swabs, and they also did samples of the placenta and then serum samples, blood samples. So they took those at the time of either labor and birth or miscarriage, and they found that the chlamydia, the chlamydia bacteria, was higher in the miscarriage group. Before they took out any sort of factors, it was 15% for the patients that had a miscarriage to 7.3% for those without miscarriage. And then after they adjusted for different factors like age, education, origin, number of sexual partners, they ended up getting more amplified results. So they ended up with like 4% in the miscarriage group to about 0.7% in the not-miscarriage group, the control group. They had 9 women that were excluded for insufficient samples. That's just part of the experimental process. But chlamydia, what they knew beforehand was that there has been an increase in chlamydia over the past 10 years, so more people have it now. And if left untreated, it can cause pelvic inflammatory disease, salpingitis, which is the inflammation of the fallopian tubes, infertility, and ectopic pregnancy, which is when the embryo implants somewhere other than the uterus, or like not in the right place. And then it also causes preterm labor. Membranes might break too early. So they ended up finding, but there had not really been any research about the correlation between miscarriage and having chlamydia. So that's what they ended up doing. But seeing the other symptoms, you can kind of tell that that it would probably correlate with it, and they found that it did. There had been studies that were done previously that said that there wasn't a correlation, or that they couldn't, they were inconclusive, but they did those tests like 10 years ago when there wasn't a big prevalence of chlamydia, and when they didn't have as good of tests, they made sure they said in here that they did have really good tests that would detect even like 10 DNA copies that were not right, and then it also detected newer strains of the bacteria. So there was all sorts of different precautions that they took to make sure the results were accurate. So what do you guys think?
Were there any part of the test that showed there was a connection between chlamydia bacteria and that baby that was being born? Like, did it have any effect on the baby, or did they not look into that?
They said that that chlamydia itself can cause inflammation of the placenta, and then it can also get into the fetus itself. But they didn't really say what sort of effects it had on the baby after it was born. I don't think they did like a follow-up.
Like after effect?
Yeah.
Long-term effect?
Mm-hmm. I'm not sure if they can inherit it or anything like that, but. And one of the things I thought to bring up was, I know that they're like in the government nowadays, they're talking about cutting funding to Planned Parenthood, and it doesn't sound like such a good idea if there's a rise in chlamydia and a rise in miscarriages and all that. So.
Did they say what term, what trimester any of these miscarriages were? Were they later on in the pregnancy, or was it early?
Let's see here. They have the pregnancy weeks for the miscarriage group: week 8, week 7, week 6, week 12, week 6, week 11. So fairly early. And then
kind of the second month then.
Yeah.
Yeah.
So they know exactly what the bacteria chlamydia does to it to cause the miscarriage and stuff.
Yeah, it's just the fact that it irritates the placenta and it irritates the fetus itself and can give the baby chlamydia, so that. And then once the bacteria gets into there, they'll just.
Isn't
die.
that the time in pregnancy when the central nervous system and all is being developed too? Isn't that usually when it gets into fairly early on,
the second month?
Is that when it's all starting? So maybe the chlamydia.
Yeah. I think that's what we learned last year. And I think you're right. So that could tie in. That's why they miscarry then, because the fetus can't develop any of those things.
Yeah.
I'm thinking back from child and adolescent development, you have that little thing that shows
the
everything being
tissues
developed.
become specialized and.
Yeah.
It's fairly early on though.
Yeah, it is.
So they just tested it was everyone with chlamydia, or people without and then people with?
They tested. They just had 386 sort of random people. Just say, I guess at the beginning of their pregnancies, they would ask them, would you like to be a part of the study? And then if they ended up having a miscarriage, or if they had miscarriages in the past, they tested everyone, so that they didn't know if they had chlamydia or not. But what else they found was that miscarriages were less frequent if chlamydia was in the primary stages, so if it was just starting out. And they also found that even if you had chlamydia and it was cured and everything, the scarring effects, they called it, I think, the scarring effects could still cause miscarriage. There's still a correlation between that. So. Mm-hmm.
Isn't chlamydia? I think chlamydia, gonorrhea, one of them there's only one antibiotic that can cure it. One of them's keeps changing and evolving. I can't remember which one it is, if it's chlamydia or gonorrhea, but it's one of them that antibiotics aren't working as well on them either now.
Yeah, they did mention that there was a new strain of this one out, so it might be this one.
Did it say anything about how if the patient is given the medication to get rid of chlamydia, if they're still affected?
Yeah, they said that some of them that had chlamydia in the past but didn't have it now still might have had
still had a high risk for miscarriage.
Mm-hmm.
So it still has to be in their system then.
Right? Yeah, because it does it has scarring, so it damages the cells maybe a little bit.
Okay.
But if they said they caught in the primary phase, before maybe scarring, that wouldn't be as bad.
Mm-hmm.
Yeah,
exactly.
So it's people who have the scarring, those are people who have chlamydia for months and months and don't realize.
Yeah, they say that at the end they end up saying all women experiencing a miscarriage should be screened for chlamydia. So, maybe if you have a miscarriage, it would be an indicator of chlamydia. So they're saying to get tested if you had a miscarriage.
Wow.
That's interesting.
Mm-hmm. And then, if you do end up having it, then to get extra help along the way for your next pregnancy.
Wow.
Did it say anything about if it would affect their next pregnancy?
If they had,
Well,
yeah.
it's in their system, even if they get rid of it, but because they already had that initial miscarriage, just saying
They had
like that.
they had a few results in here that showed that there were women who had repeat miscarriages. Number of pregnancies too. These were in the miscarriage group, so some of them had 5 pregnancies. I'm not sure what parity means exactly. I'm not sure if that's the number of babies that lived. I think that's Well, because it says miscarriage group number of pregnancies 2, and then it says parity 0. So it might mean that none of those babies survived. Then 1 to 0. Yeah, so one of the women had 5 pregnancies and 2 ended up surviving. So
That's horrible.
Yeah, they didn't do any follow-up on the children.
No.
That would be interesting to see if they were affected.
Yeah.
Like if the bacteria is in them.
Probably.
Or if they have some kind of defects, or
Yeah.
if it limited their growth or health or
Some type of brain damage or.
Even the girls, it'd be interesting to see if the girls, later in life when they were pregnant, if it affected them.
Yeah.
Oh yeah.
Yeah.